Okay. Do we want to go around and just introduce ourselves?
Sure. Should we start out by just saying what we're doing here?
Yeah.
Do you want to do that?
Sure. Yeah. So, hi, I'm Andrea. I am the program assistant for the Coalition to Prevent Lead Poisoning. And I'm so glad that we're here today with Len, and I'll let him introduce himself in a second, to talk about what to expect with home lead inspections specifically. So we have a couple of questions that we're going to ask Len, and if anyone at the end, we'll open it up for questions from you if you'd like to go ahead and unmute yourself. And it should take no more than about 30 minutes, so we'll try and keep on schedule as much as possible. Len, you want to go and introduce yourself?
Sure. Thank you, Andrea. Hi, my name is Len Merritt. I'm the Manager of Code Enforcement for the City of Rochester. Previously in the position of Lead Paint Program Coordinator for the City of Rochester for many years, and certainly appreciate the opportunity to come and talk about what we've done over that time, and just appreciate your invitation. Thank you.
Thanks, Len. And Elizabeth?
Hi, I'm Elizabeth McDade. I am the program manager for the Coalition to Prevent Lead Poisoning and have been working with Len for at least a decade now, I think. We have some of our community partners on this call as well. So in our times of COVID, I think it's really great to be able to provide these opportunities for us to have these conversations and create this and present this information for people who might not be able to otherwise access it. So thank you so much, Andrea, also for your work in organizing and putting this whole thing together.
Of course.
Do we want to go, are you going to call on people to ask them to introduce themselves, and then we'll just go in a circle and then we'll do the questions, or how do you want to do that?
Yeah, sure. We can get some introductions going. So I'll just call on how the names appear on my screen. So right next to me, I have Emily. Looks like you're muted, Emily. There you go.
Thank you. So I'm Emily Latanwa, fairly recent transfer from Boston, where I used to live and did a lot of work with social determinants of health. So I'm interested to hear what's going on in Rochester around code enforcement. Thank you.
Welcome.
Great, thanks. I see Darren. If you're speaking, Darren, I can't hear you. You're muted. That's okay. I'll move on. Darren, if you are able, oh, here we go. Darren says he doesn't have a microphone, as well as Deb. They're from Genesee County. Great. Thanks, Darren. Thanks for joining us. I see Linda is with us.
I'm hoping you can hear me.
Yep, we can hear you.
Okay, because I'm in a different office today and there's no camera on the monitors and I'm using my phone. I guess I have to introduce. I'm the nurse manager for the Childhood Lead Poisoning Prevention Program for the Monroe County Department of Public Health.
Thanks, Linda. I see an Elizabeth Wilson. I can't hear Elizabeth. You might be on mute. All right, well, that's okay. I will move on to Marianella.
Hi, my name is Marianella Quiroz. I am an administrative assistant for the lead-based paint program here in Utica, New York.
Great, thanks for joining us. I see an Ann Murphy.
Yes, this is Ann Murphy from Yates County Public Health. And I'm just interested in and what's going on in Rochester.
Hi, Anne.
Hi.
And then we have Matthew.
Hi, this is Matt Bemis. I'm a relatively new hire with the EPA Region 2 Edison office. I'm a project officer and I'm on the program side. I'm just here to learn.
Great to have you. I see Marilyn. Marilyn says she's a new landlord and does not have a microphone. Thanks for joining us, Marilyn. And I think last we have Kate.
Hi everyone, I'm Kate Falone. I work at the University of Rochester Medical Center in the Environmental Health Sciences Center, and we do community outreach and engagement. And we worked with Len a lot in the past. We miss him very much with the Rochester Healthy Homes Partnership. So happy to be here.
Awesome. And Elizabeth Wilson says she doesn't have a microphone, but works in Buffalo Western Regional Office of the Department of Health. Great. So if Elizabeth or Len want to start, I will let them, but I thought maybe it would be helpful to just give a quick background on why talking about lead poisoning prevention is important. I know a lot of people here probably have some familiarity, but I'm sure there'll be people who are seeing this who might not be so familiar. So maybe if we could just talk about that for a couple minutes.
And do you want to do that or should I?
No, you go ahead, Elizabeth.
Okay.
You've been integral in this process from the very beginning. So sure, go ahead.
So lead is a neurotoxin, and it is an element that's been in paint for several decades. This country eliminated the use of lead in paint in 1978 and in gas in 1978. But we still have residue from those sources in our community. Lead actually impacts the way a child's brain develops. And so you're talking about permanent brain damage in some cases. There's lifelong impacts for adults as well. It really is bad for anything that has a nervous system, including pets. And so one of the things the Coalition to Prevent Lead Poisoning was put together about 20 years ago at this point. And in 2004, had a lead summit, and then in 2005, worked with the Rochester City Council to have a lead ordinance voted on. That passed unanimously, and then in 2006, the lead ordinance began implementation. And so we've had a lead ordinance that's tied into the certificate of occupancy inspection process for rental properties in the city of Rochester now since 2006. So we're going to talk about a little bit today. And let me also just say that one of the things we're doing with the coalition is we're trying to have a series of these types of conversations. So we're going to try to be very focused in what we're talking about today, knowing that we're going to be doing additional talks with other information as well. But please do include any information you might have in your chat. I've been very brief in my table setting of what lead does. We could talk about it for a very long time. But I want to make sure we have time to answer the questions that we've talked about with Len. So thank you.
Great, thanks, Elizabeth. So you already touched on this, but I guess I'll direct this to Len. Can you explain a little bit more what the City of Rochester lead ordinance is?
Sure, thank you, Andrea. The city's lead ordinance, as Elizabeth mentioned, went into effect in 2006, July of 2006, which mandated that any rental property that was built before 1978, which encompasses about 90% of the city of Rochester, had to be inspected for any type of lead hazard, which would include deteriorated paint, any unstable paint condition that our inspectors would cite based upon a visual inspection of that property, and then require the owner to have it corrected if it was deteriorated, or if the paint was stable, then our inspectors would go out and then do a test to ensure that there were no lead dust hazards in the property. And we do that test at any interval based upon our inspection processes, whether it's a complaint inspection, C of O inspection, certificate of occupancy, or if there's a sale of a property, we can also go in there. And if there's those type of conditions that exist, then our inspector will then do the test and then see whether the results are in compliance with EPA standards. So that's done on a periodic basis. We do it every, I'm sorry, Elizabeth.
I was gonna say, before you go, what kind of conditions are you talking about?
Well, we have several types of conditions that mandate us to then require some kind of remediation that would require a test after that work is done. And that is usually when the paint, and the definitions are all under, in EPA's website. People can find that paint is cracked, paint is peeling, they have the alligatoring effect on the windows when the, condition of the paint has been affected by weatherization. So all of these kinds of issues can exist that then would mandate some kind of corrective action that the owner would have to do. And then after that work is completed, to ensure that there's been a proper cleanup, then the test is performed. So that's what we've been doing. All of our inspectors here in the City of Rochester are certified, EPA certified clearance testers. They're either dust clearance, dust sampling technicians, or they're lead inspectors or risk assessors. They all have those credentials. So they're all trained to know what deteriorated paint looks like. They're all trained to take samples. And, of course, they're educating folks each time they go out to an inspection. So this is a very well coordinated process that we, in partnership with all of the agencies that are, most of them are on this call here, share in that responsibility. So they forward us information, we gather it. If there's an inspection needed, we'll go out, make sure that the tenants are living in safe and decent housing. And we've been doing that since 2006.
How many properties have you inspected in overall at this point?
Well, from 2006, wow, probably close to 60,000.
I actually think it's more than that.
Yeah, it could be. I know that I'm not including those that, we obviously go out and re-inspect again. So Rochester only has about 67,000 properties, and about 40,000 of those properties are rental. So obviously, they've been recycled, so to speak. We've gone out to them several times since that period. And, but yeah, around 40,000 properties, give or take.
So I have two questions. One, I know that the City of Rochester actually reports on your inspections every year. That's actually one of the protocols for the lead ordinance.
Yes.
Was that, and I put the link in the chat. If you go to the City of Rochester, there's a report every single year as to what percentage of properties have passed, et cetera. So there's quite a bit of transparency in the data. Can you speak a little bit about the timeline for the C of O? I mean, so there's a couple different strata for the C of O, right? Some properties have a certain timeline and others have different ones. Can you talk a little bit about that?
Yeah, that's pretty easy. These are all mandated by the state. The city really has no control over that. The state sets those time periods that each inspection must occur if it's a rental property. So 1 and 2 family houses are inspected every 6 years. And there could be other reasons why we go out a lot sooner than that, but for the most part, generally speaking, every 6 years we'll be in that property, if it's a rental property, to inspect it at that 6-year period of time expiration. For any property that is 3 units or more, 3 apartments or more, or in a mixed use, meaning that there's a store or business attached within that property, then those are inspected every 3 years. So we're out there for those type of inspections every 3 years. And again, all of that's state mandated. Anyone can go to the New York State Department of Buildings and see that information on there. It's actually under Department of Labor, but definitely you can see the cycle by which those inspections must occur.
But in the city of Rochester, we also have a complaint-driven process. So
Yes.
if I'm a tenant and I've rented an apartment and the C of O was passed 4 years ago, so that means the timeline isn't up yet. If I identify or I believe that there's a lead hazard, I can call the city of Rochester and you'll come and do an inspection just to identify whether or not there is a hazard. And I don't have to have my landlord's permission to do that. Is that correct?
Yeah, that's a protected right in our lead ordinance that was put in just to ensure that there was no retaliation. Folks have a pretty good idea based upon all of the education and information that's been put out there, whether or not, that kind of condition exists. It really is not that hard to determine if paint is peeling in your house. I think we all know that. Whether you're a homeowner or a renter, most people know what it looks like. And there are, believe it or not, still some landlords out there who will not do what they're supposed to do in a timely fashion to mitigate those problems. And so we put that in there just to ensure that if a tenant wants to call and make that complaint, and there are other reasons why they can call and complain too, which are protected rights when it comes to those phone calls. We want to make sure that based on this particular violation, that they can call us without any type of retaliation, because it is a serious effect. If a kid gets lead poisoned, and those of you that work in this industry, this profession, that there's really no cure for that. So we want to get out there and be proactive about any kind of perceived lead violation in that home.
One of the things that I think is interesting about this ordinance process, so there's a couple of different components to it. One is the one you just described, if it's complaint driven and there's somebody currently inhabiting the apartment. But typically the apartments are inspected during, or the homes are inspected in the in-between time between rental systems to meet the C of O. So if an inspector goes in and conducts a C of O inspection that includes the lead inspection and determines that there is a hazard there, what's the process at that point?
Well, that's internally, we have to issue a notice and order, which then is a form of communication, a legal form of communication, that we put the owner on notice that there is a violation in that property. And based upon the verbiage within that notice and order, it details to that owner what he or she must do in order to correct that violation. So with lead is pretty easy as far as the instructions of what you need to do. And I think that's the simplicity and the way that owners can understand it, because, in Rochester, we have a mixture of owners who have high and low abilities to understand what it is that is being sent to them. So we wanted to make it as simple as possible so that no one would, misunderstand what is being asked of them to do. So the ordinance says you have to correct it using lead safe work practices. We would prefer that anyone that corrects this paint be RRP certified, and that's also in that verbiage.
That's repair and painting. That's a sort of,
yes,
that's a federal certification.
Absolutely, because then we know that you have the basic understanding of how to do it properly, how to do that cleanup, how to ensure that the materials that you're using, the products that you're using are going to really do something to remove that lead from that surface if there is lead in that paint. So we make sure that all of those type of instructions are in there for anyone to know. Once that work has been corrected, then the owner has to get a private company to come out, which we supply a list to them. They can obviously choose whom they want, but we try to make it simple for them to get someone out there to react to it quicker. And these companies are vetted by our office to ensure that they're in compliance and not that what they're doing out there, they're not overlooking anything. And then once that report shows that it's achieved compliance, and they send that report in to be evaluated and reviewed by our office to accept it.
And then one of the things that's also another layer of safety is that your office also does audits of those companies that are doing the third-party inspections. So there's a really nice, there's an ongoing evaluative component to all of this. So
and that's crucial. In fact, as you know, we get many calls from around the country from different municipalities that want to sort of imitate what Rochester does. We've been tagged with the title of the gold standard in the country when it comes to this kind of process. And I think, anyone can gain that title. If we're all doing the right thing, everyone should say that they have the gold standard when it comes to lead remediation, especially from childhood lead poisoning. So I don't really take that as seriously as a lot of people would say. I think we're doing the right thing. That's my point.
And there's constant evaluation.
There is. So,
that allows you to be able to have a standard.
Absolutely. And we're looked at by everyone. We get constant audits from other, folks. The Center for Governmental Research comes out. Of course, we're always kept on our tippy toes by the agencies that we're working with, the University of Rochester's Medical Center, like Kate was mentioning that she's from. So we get our own look at, by the State Department of Health. All of those agencies are involved. But going back to your question about the audits, we want to make sure that everyone is following what we set in the lead ordinance. It just wasn't a document, and you know that, Elizabeth, from day one. It wasn't something that we just wanted to say we wanted to add another layer of enforcement on. That wasn't the point. It was the point to ensure that kids were living in homes that were safe and healthy. And if we couldn't get to that point, then that ordinance meant nothing. So we want to make sure that everybody realizes that whether you're a city employee or whether you're one of the private companies that has to go in the house and test, that you're following the same thing. And we have probably over the course of those years suspended more than half of those companies at one time or another, simply because they weren't following the prescription that we mandated in the ordinance.
Again, to sort of underscore your point about this idea of being proactive, right? I mean, so that all of the data, right? And that's one of the things, and I'll also go back to saying, your community partners, including the Coalition to Prevent Lead Poisoning and including the County Health Department, all of your community partners, we all work together, but we'll be the first to call each other on the carpet if we think something needs to be addressed. And the beauty is, at this point, we all trust that we are really looking out for children and to try to make sure that we are keeping our community as safe as we can. And so, we hold each other accountable. I mean, there's so many different layers of accountability built into this process at this point. And what's also interesting is that even at this point in the process, there still needs to be ongoing evaluation. There still needs to be ongoing evaluation. All of these different types of things of thinking about, how does it work? What's the best way to make it work? Because things change, life changes, COVID changes, and we're going to get to a question. I suppose we should kind of go on to the next question that we had, which was, so what does a lead inspection actually look like? What would happen if I called you up and said, I'm a landlord, please come over and inspect my property for a lead hazard?
Well,
all the landlords call you up and ask you that, right?
Oh, yes. Well, it's pretty standard. I think over the course of the time, the only thing that's changes is the face that has to come in the house and do the test. So since day one, we've always, if we got that call, we would come out, obviously, and do a visual inspection. That's part of the regulations that are required from both EPA and HUD. Everyone has to go in the house and do a visual inspection. We're going to look to make sure that there's no deteriorated paint anywhere. If it is, we stop. We point those areas out. We ask you to correct them, and we ask you to do a thorough cleanup. Now, there's other things that go along with that that folks should learn, and that's where that RRP course comes in, because you want to maintain, some type of containment so that the dust doesn't spread throughout in the house and other areas. Wearing, and obviously I'm going to use that nomenclature now because everyone's using it, PPE. You want to make sure you're in the proper PPE when you're doing that work, just so that you're not spreading dust throughout the house when you're doing that kind of work.
You actually bring up a good point. The renovation, repair, and painting rule, which is an EPA standard, has been on the books since 2010.
Yes.
And the requirement is that anybody who disturbs, regardless of job work scope, anybody who disturbs 6 square feet on the interior or 20 square feet on the exterior of a pre-78 structure has got to be certified in RRP. So that means plumbers, that means HVAC, and it certainly means landlords, because the idea is that if you're receiving compensation and you're doing this,
that's right.
And rent is considered compensation, even if you are working on your own properties, even if you're a landlord that owns a double. If you're doing work on the and you live in one side and you're doing work on the next side, you need to be legally, you need to be RRP certified in order to be able to do any of that work. And pre-COVID, we were lucky in this community to have had, at this point, 10 years worth of free classes for RRP certification. So hopefully once this is all over and we're going back again, we'll still be doing that. But I think sometimes property owners don't understand that they are also required to be RRP certified.
Yeah, and even if it's not free, the money that you have to pay, is so minimal compared to what the outcomes that you're going to have in that property. And certainly the peace of mind that you have knowing that you've done everything possible to keep someone from being lead poisoned in that home. So even if you can't find a free class, that should not be a hurdle or an obstacle for you not to learn the proper ways of mitigating this kind of condition in that house.
Well, it's been the law for 10 years now. So yes,
Yeah.
You're right. The free class is not the thing to stop you from being RRP certified.
That's absolutely correct. So once our inspectors look over the house and make sure everything's fine, then we'll go through and we'll do testing in the home. We usually do 2 samples in 4 rooms.
What is a sample?
I'm sorry?
What is a sample? What do you mean by that?
A sample is where we go through and we take a dust wipe sample. We use there's what we call dust wipes or ghost wipes that, are within certain areas of the home. They could be on the floor. That actually looks
like you tape off a certain area, square foot, correct?
Yeah, there's all different kinds. Yeah, there's all different kinds of ways to do it. We have templates that we use. Some people go through and they'll tape off an area. And then what you do with that is you write down the size of that area that you've tested and the surface by which you test. And again, the EPA only requires that there be 3 types of surfaces that are testable, which are floors, window sills, and window wells. So our inspectors will go ahead and they'll definitely make a decision as to what they want to test. Obviously, floors are always going to be part of that equation, but window sills, they're window wells.
The point is to measure, when you send that off to a certified lab, the point is to measure the parts per million, correct?
Yeah, and again, it's
a certain square footage.
Yeah, it's pretty routine. We don't expect the tenants or the landlord to know all of that, but definitely they know that we're going to be testing those surfaces to ensure that any dust that was created was properly cleaned. And we'll know that.
Test that is by doing that dust wipe,
Yeah, and once those dust wipes are sent into the lab, they'll do their analysis and send back the results, usually in about 3 to 5 days, and then we'll report that result to the owner. If there's a retest that needs to be done, we'll ask them to retest those areas that re-clean those areas that need to be retested, and our inspectors will go back out. Now, we only give one free retest. So we ask everyone, this is why it's so crucial that you follow those steps very carefully that Elizabeth mentioned about the RRP, the renovation, repair and painting course teaches you, so that there shouldn't be any problems once we come out there to do a test.
So if I'm a tenant and I call for an inspection, say I'm receiving a housing subsidy from the county, and there's a lead hazard that's identified, what's the process then?
Well, again, it really is not a city problem or issue, I should say. Each of those agencies and Department
So
of...
this is a property in the city. Say I live in the city, but I'm receiving a housing subsidy from the county, from like DHS, and I believe there's a lead hazard, and I call the city to come and do an inspection, and you find that there is one.
Well, those agencies have, in their protocol, decided that that's what they want to do, is then suspend rental assistance to those properties. So that, again, the city is only there to determine whether or not a hazard exists and what level of hazard that amounts to suspend the rental assistance, both from the Department of Human Services or the Housing Authority. Then they mandate that rent be suspended based upon that particular violation. So there is a lot at stake. Again, I caution owners to not be so concerned about the rent. That's the conversation I have with anyone, is not to be so concerned about the rent, although I know it's important, but your best business practices are going to help you navigate that stream. Keep your properties in lead safe conditions. That's also a mandate of the ordinance, is to maintain your property in a lead safe condition. You won't have this problem. You won't have tenants calling us and saying, hey, nobody's taking care of this. So if you're doing your due diligence when it comes to your property, you really shouldn't have this problem when we come in to do our inspections or have a tenant calling to complain about your property.
So what are some of the resources you offer up to property owners?
Well, at this point in time, the city still has this lead grant program, which I think most of the public knows. We put that information out there.
I also put a link in the chat to the information about the various programs.
Great. And we also have other programs too, and I don't want to bore everyone about it, but you can go to the city's website and you can see everything that is out there that's available to you if you qualify. So that's the parameter by which you have to know up front, is that you have to qualify for a lot of these programs. You know, they'll triage that application to see what best fits you, and you know, based upon the requirements that they're required to ask of you.
So we're coming up on the end of our time here. So do we want to move into questions?
That's quick.
I was going to say, do we want to just talk very briefly about what the process looks like now during COVID, and then go into some questions?
Sure. Yep.
Well, the process by which we're doing right now, obviously, there's a lot of restrictions. There's questions that have to be asked prior to any inspection going into anyone's home. We are doing full C of O inspections inside of a house, but we're restricting the number of people that can be in there with us. Obviously, everything that's been recommended by the County Department of Health must be adhered to. So there's got to be mask wearing, there's got to be social distancing. Our inspectors aren't allowed to touch anything while they're in there, so they can't move curtains, they can't open doors. That has to be done all by the owner or the tenant that's in the property. We're still doing lead tests, so if people have issues that or if tests have expired at properties that are required to have tests done in the high-risk area. We are doing that, but we are taking the precautions. Our folks are wearing masks. They wear gloves as often as possible, and certainly they have all other kinds of PPE that they can use while they're in their booties if needed, so that we can protect whoever lives in that property as well. But right now we are back to full speed when it comes to that, other than with the number of people that can be involved in that inspection.
Thank you.
So with that, I guess we can open it up. If anybody has any questions, you can feel free to unmute yourself, or you can put it in the chat. All right.
We answered everything.
We did a good job.
I guess I would ask, Len, what do you feel like is the most common question you get from landlords about inspections?
Well, the only thing that really is I guess number one question that comes up is what has changed in the code. Obviously, the New York State and the international codes change every so often, and we try to get that information out to the owners prior to our inspection. So we try to post as much as we can on the website so that owners can be aware if there's been some change. Right now, the most prevalent change, or the biggest change, is the energy code. There's a lot of things that need to be done to homes to ensure that energy is not lost out of that home, as it was back in the, maybe 10 or 15 years ago. So other things that could change is, handrails, obviously, smoke detectors, things like that. They're now required to have the 10-year smoke detectors that are unopenable, so that tenants can't go in and remove the batteries and obviously have problems in the home when it comes to a fire. So a lot of things have changed in those areas, and we try to share that information with the public online as well as through conversation.
I'd like to make a comment to really sort of commend all of our community partners, right? I mean, the City of Rochester already had the C of O process in place. Adding a lead ordinance. I mean, it's all a good thing now, but, quite honestly, it wasn't necessarily as friendly when all of this was happening, because change is hard, and this idea of sort of implementing a new process is difficult. But I have to say, one of the things that's really been really wonderful to observe and to really respect is the process the City of Rochester and the County Health Department does, for example, in really trying to share, information systems that don't necessarily communicate with each other, but understanding that, the city does the housing inspections, the county does the health inspections, and to look at why something like this is an important tool. Monroe County has seen a reduction of children reported with lead paint poisoning decreased by over 80% in the past decade. And there's many, Dr. Stan Schaefer will yell at me if I don't say that there's many contributing factors that go into this. And certainly part of it is the healthcare worker, all of that stuff, the county health department, certainly. But even the former director of the county health department, Byron Kennedy, worked with his staff to do an evaluation of decreases in lead poisoning across New York State. And in Monroe County, they identified that the rates came down 2.5 times faster than they did in any other county in New York State at the same time, given all of the other things that were, measuring apples to apples. And they decided that, they found that it was really the work of the Coalition to Prevent Lead Poisoning, working with community partners, but that the lead ordinance, this idea of identifying proactively where there is a hazard, right? We already know that there's a hazard there. So why would you just wait till a child is poisoned to identify that there's a problem? You know, get rid of the problem before the child becomes poisoned. And it's really been, you know, really a collective impact initiative to see how this community works to consistently evaluate and redress and understand, you know, given funding streams, all of those different things that change, you know, from year to year, but consistently looking at how do you make the systems work so that we are keeping children safe.
Well said. All right, well, if there aren't any more questions, then I think we've reached our time limit. So thank you everybody so much for joining, and thank you again, Len. We're so glad that you were here to answer some of those questions.
We'll be having this on our YouTube channel, and we'll be also hosting other conversations along these lines. We're gonna have some short and sweet conversations to answer questions about this stuff. So thank you very much to everybody who participated today, and thank you so much, Len, for sharing your invaluable expertise. Our community is certainly very, very lucky, very fortunate to have people like you and like the whole team at the city doing the hard work that you're doing. So thank you.
No, I appreciate it, and I appreciate the invitation. I was just waving at Joe. I've spoken to him multiple times. So.
Is it the first time you guys are seeing each other?
Yeah. Well, it's kind of nice to always see familiar faces, and certainly, you know, Elizabeth, you can call on me any time of the day. It doesn't matter. I'll always be available for you. So anytime.
Thanks so much, everybody. Take care.
Thank you.
Bye-bye.
Thanks, everyone.
Take care, y'all.
Bye.